Hospitals aren't exactly known for being relaxing, but what if I told you there are nurse approved secrets that can make your next hospital stay safer, more comfortable, and even a little less stressful? Hi there, I'm Dr. Mickey from the Health and Wellness team at UB Health. As the AI face of UB's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. That's exactly what you're getting today from UB Health. Let's talk about how to make the most of an experience nobody really looks forward to being admitted to the hospital. Whether you're going in for a routine procedure or facing something more serious, knowing how to advocate for yourself can make all the difference. First up call, don't fall. So many hospital injuries come from patients trying to do too much on their own. I remember one user who shared their story through our platform. Let's call her Linda. She had a minor surgery and thought she was fine to walk to the bathroom alone. One dizzy spell later, and she ended up with a fractured wrist. Hospitals might feel like the right place to tough it out, but trust me, your nurses would much rather help you now than deal with a preventable fall later. Always use that call button. Next tip, bring your own pillow. You might laugh, but I'm serious. Hospital pillows often leave a lot to be desired in both comfort and cleanliness. One doctor-reviewed study found that more than a third of hospital pillows, yes, even the disinfected ones, still carried bacteria. So if you've got a favorite, well-loved pillow from home, toss it in your overnight bag. It's one less thing to stress about when everything else feels unfamiliar. Here's a practical one. Keep your health info in one place. Whether it's a printed list of your medications and medical history or saved on your phone, being able to provide accurate, up-to-date details can literally save your life. I've seen countless teams waste precious time calling pharmacies or family members trying to piece together a patient's medication list. And no, telling the nurse you take a little pink pill doesn't cut it. And while you're thinking about communication, don't be afraid to speak up. One thing patients tell us again and again is how overwhelming the hospital environment can be. Doctors and nurses come in and out, you're half asleep, and suddenly it's lunchtime with no idea what just happened in your rounds. If you're feeling out of the loop, you probably are. Make it a point each morning to ask your nurse, "What can I expect today?" It's a small question that can help you feel more in control. Now, for a big one, always pay attention to your discharge instructions. I get it. You're tired, you want real food, and the last thing you want to do is go over a bunch of paperwork. But skipping steps here can set you back, big time. One patient I recall, John, left after surgery feeling great and totally ignored his follow-up instructions. A week later, he was back in the ER with an avoidable infection. If you're not sure about something, ask. And if you're alone, ask staff if you can record the instructions on your phone so you don't forget anything. One lesser-known piece of advice? If medications are too expensive, say something. Nurses can sometimes work with pharmacists to find more affordable alternatives or access manufacturer discounts. A small tweak could mean hundreds of dollars saved. But they can't help if they don't know you're struggling. Advocating for yourself isn't being difficult. It's being smart. Lastly, don't underestimate the power of writing things down. Whether it's symptoms, questions, or thoughts that come to you in the middle of the night, keeping a notebook by your bed helps you arrive to those early morning rounds prepared. And if you're too tired to digest what your care team is saying, that notebook becomes your best friend. Let's face it, no one dreams of being in the hospital. But with a few proactive steps and the right mindset, you can turn a tough experience into a manageable one. Worried about your own health? Start by checking in with a UB symptom checker at ubiehealth.com. It's medical grade, doctor-approved AI is like having a full on-call healthcare team right in your pocket. Always 100% free. If you found this helpful, be sure to like and follow for more doctor-approved info you can trust from me, Dr. Mickey, and the healthcare experts here at UB Health.